good to see you back at your old home.
I'd be sitting right next to you, I think, if we're still here.
Actually, I kind of like it where I'm sitting closer to the middle. I appreciate the points that you made in your testimony about mental and behavioral health, especially among young people. It's something that I'm extremely concerned about, and I'm glad the department continues to take proactive steps in this regard. But I'm going to repeat something today that I said the same time last year. There's not enough money in the world to address the mental health crisis by treating symptoms. We invest far too little in understanding the brain itself and the underlying neurological roots of depression, bipolar disorder, and other common and challenging conditions. We've got to get ahead of that curve, and if we do, the benefits to our health and frankly to our economy are impossible to overestimate. That's why Mr. Kelly, my friend on the tax committee, and I have been working on legislation to provide tax incentives for this sort of broad neurological research. Mr. Secretary, we're kind of fine-tuning our legislation right now, and I'd appreciate it if your team could take a look at and offer comments as we do this. Your support would be incredibly important and appreciated, and we can truly help people with mental illness challenges.
We look forward to working with you.
Thank you. I'd also like to ask about telehealth and telemedicine. As you know, Mr. Secretary, I've been working on this issue for a long time, since even before we were colleagues in this committee. And I wrote, along with Mr. Schweiker, the legislation that made telehealth available to seniors on Medicare during the pandemic that you referenced earlier in your testimony. That access provided invaluable, and it was the telehealth flexibilities that we put in place are set to expire at the end of this year. Mr. Secretary, how does your department view that upcoming deadline? Have you been evaluating the data coming in from the past few years? And can you tell us more about the need for this, the importance of this, and what you think we should be doing?
Congressman, I don't think there's any doubt that we need to maintain these telehealth flexibilities. In fact, even more so on the behavioral health side. When we hit the pandemic and we started doing telehealth, a lot of folks thought it wouldn't work on the mental health side, but it's actually one of the areas where we had the greatest success. And so the last thing we need to do is allow them to expire. We're prepared to work with you to make sure that you all are able to, on a bipartisan basis, reach some agreement on how to extend those flexibilities.
Thank you very much. And the chairman stated when he made his opening comments how important it is to provide health care opportunities and access to people in rural areas. And that's all underserved areas. And telemedicine is a way that we can really expand our reach. So thank you for your help, and I look forward to working with you, and I yield back the balance of my time.
Thank you. Mr. Smith.